My name is Ashley Crosby, and this is the IV therapy checkoff. So first, we're going to get our patient's chart. It's Mr. Doe. We're going to verify our orders. We're not going to have any allergies. The patient doesn't have a history of CHF, renal disease, a mastectomy, no AV shunt, and no strokes. We're also going to assess lab values and their vital signs, and she hasn't had any surgeries, and she doesn't need any. Now we're going to hand hygiene. We're going to gather our supplies to do the IV. We have our IV start kit, the extension set, the 22 gauge IV cath, the flush, alcohol prep pads, and the arm barrier. So now we're going to go into the patient's room and we're going to knock. We're going to hand hygiene. I'm going to introduce myself. My name is Ashley Crosby. I'm a Bevel State Nursing student. What is your name and date of birth? I'll get it from Mr. Doe, 12/10/91. And then I will be explaining to them that we are starting an IV and the physician's order has been placed in the computer. So first I'll put my supplies to the side and then I'll be disinfecting my workspace. Then I will get out my moisture barrier. And then I will get out my supplies. And when I ask their name and date of birth, I'm also going to verify it by their hospital bracelet. Now we're going to open all of our packages the sterile way. So we'll fold back and fold under. Okay. Then we are going to connect our flush, but first we're going to prime it. So we'll remove the needle. We'll push any air out. And then we will connect it to the extender. We will remove the end cap, but we will not go inside where it is sterile. And we will place it back in the bag and cover it back up. Next we have our tape. We have two 5-inch pieces and one 3-inch that's been split into two. So next we're going to go over to our patient and we're going to kind of assess the daily living activities. We're going to see if they've had any previous IVs, any problems with it. We'll find out what the dominant hand is. We will test for any edema, and we will listen to any lung sounds, and we will also ask for the allergies. We will also look at skin tugger for any dehydration, and then we will notice for any jugular distension. Okay, so next we will get our arm barrier. Place it under where our IV site is going to go. This would have been a lot easier if I just done it long ways. Okay. So now we're going to get our tourniquet. We'll want to do it 4 to 6 inches above where our potential IV site is going to be. Okay, now that we've got this tight, we're going to ask our patient to squeeze their hand slowly. We're going to make sure that the arm is lower, the vein site's going to be lower than the heart, and we're also going to rub down on the vein. Then we will take the tourniquet off. We will apply our clean gloves. then we will clean the side. We will start in the middle and go outwards, but we want to make sure we go all the way out in case we need to pick another vein. We don't want to fan it dry. We're going to let it naturally dry with air. So now we're going to reapply our tourniquet. Okay. Then we're going to go over and we're going to get our IV calf. We're going to tell them that this is going to be a slight stick. It's going to be uncomfortable, but try to relax. So when we go in, we're going to want to do a 10 to 30 degree angle with the bevel up. And then we will be looking for some flashback. And if we get it, we're going 1/4 of an inch in. So here we go. The bevel is up. We're pulling down on the skin. We're going at a very low angle. Going in. There is flashback. We're going to go 1/4 of an inch in. So then we're going to push the calf. We're going to stabilize it and let the needle fall naturally. We're going to release the tourniquet. We'll have pressure on about 2 inches up. Then we will slide out our needle. And then we're going to activate the safety. Put it in the sharps container. So we're holding pressure and we're stabilized. So now we're going to get our extension set. We're going to go to the top, but we're not touching the middle because that's sterile. So we're going to screw this on. And we are going to aspirate. We have our blood. We're pushing our saline all the way through. Now we will clamp it. If I can get it. We are clamped. Now we can release the pressure and we're going to take off the end and we're going to put it in the sharps container. So now we're going to use our tape and we're going to do in the pattern of a chevron. We're going to go under and we're going to have sticky side up. So you want to make sure not to get on the injection site. And then we're going to take our big piece of tape and we're going to loop this around. We're going to have a piece of tape at the top and a piece of tape at the bottom. Still not covering that injection site. Okay. Then our last piece. So we're going to want to put our initials, the time, the date, and the gauge size on our tape. So we'll have AC. It's about 8:30 and it is on 6/10 of 20 and it is a 22 gauge. So now I'm going to educate the patient and tell them if they have any signs of swelling, redness, fever, if anything starts leaking or it becomes just really painful, they need to go ahead and call us. So we're also going to tell them that the pharmacy has an order, the doctors put an order in for the pharmacy, and then when it becomes available, they will call us and we will come in and give the injections. So now we are going to clean up. In the waist bin, all the sharps are in there. So we'll roll this up, throw it away. We're going to correctly remove our gloves. We're going to take our time, then we're going to 2-finger it, and I have it over my watch. So bear with me. Okay. I'm going to roll it. Going to toss those bad boys, and we're going to hand hygiene out the door. But before we leave, we're going to make sure that their bed is in the lowest and safest position with the call bell in reach. And just in case, we'll hand hygiene again. So now we will actually go to our computer and start our documentation. So it is 6:10 of 20, about 08:30. We've given them an angiocath with a 22 gauge needle, and it was inserted in the right hand with one attempt because we're them good stickers. And we used a tourniquet. It was connected to a saline extension tubing, so it was a saline lock. Blood aspirated and flushed with 10 ml of normal saline. No signs and symptoms of infiltration. We secured the cath hub with clear tape, IV tape. Some sites allow you to use the Tegaderm. In this case that we didn't, we just used the IV clear tape. But the patient tolerated the procedure without any pain or anxiety. We instructed the patient to let staff know if the IV site becomes painful, red, swollen, or has any drainage. Then I would sign A. Crosby, student nurse. So now we are in the med room. I have my MAR and my physician's order. We are going to start gathering up our meds for Mr. Doe. So I'm first going to hand hygiene. And we'll start with the 2 flushes that we're going to use once we get in the room. So I have the MAR and I have the meds. So what we'll do is we'll review the 5 rights plus the expiration date. So I'm pulling it out. I've got an order for Rocephin, 1 gram IV piggyback daily, which is going to be 100 ml an hour. And this is going to be 25 drops a minute. So we have it for Mr. Doe, date of birth 12/10/91, room number 316, MAR number 123, doesn't have any allergies, and the expiration date is October 1st of 2020. So we're good there. And it's going to be given the IV piggyback at 0900. So next is the normal saline. So we have the right drug. It's going to be 30 ml an hour, and it's going to be through the IV, and we're going to DC it after the IV piggyback has been finished. So this is also going to be at 0900. For Mr. Doe, we've got his birthday, 12/10/91, room 316, MAR number is 1234. Okay. Next, we're going to have our Lasix. And this is a 20 milligram IV push twice daily, 0900 and 1700. What we're going to do is we're going to have 1 increment every 12 seconds when we go to push the med. So once again, we're going to compare the MAR to the med. We've got it for Mr. Doe, 12/10/91, room 316, MAR number 1234. So I'm going to put this stuff to the side. We're going to work on those in a minute, and we're going to start with our Lasix. So we have our 3 ml syringe, and we have our Lasix. Once again, we're going to check our expiration date just to make sure and to see how much we have in this container. So it says 40 milligram per ml, so we're covered. Sorry. We're going to get an IV prep pad. And we're going to uncap our needle first. We're going to clean this top. Okay. So we will aspirate 0.5 of air, and then we're going to take it and we're going to go straight in the center. We will inject our air, then we will flip it, and this is when we would draw it, but for the sake of this video, we're going to put it back down. And we would pretend to draw up the 0.5. So we're going to scoop and cap. We have it labeled for in the room. We're going to throw that in our bag for Mr. Doe. So that is ready to go. So now we're going to start on our bags for our IV pole. Voila. So we're going to hang this guy up, it's going to go in the lower position because the Ivy piggyback is going to be at the higher. Okay. And what we're going to do with the tubing is we're going to make sure that we have the primer at the top. We're going to make sure that our roller cap is on stop, it's off, and then we are going to spike our bag, making sure no tubing is on the floor. So we're still in our off position. We're going to go to the sink and we're going to hold the end, and we are going to turn it on. The roller cap is up. We're going to prime. Then we're going to let all the bubbles come out to the end. We're over the sink. Once we've got it to the end and all the bubbles, we'll turn it back off and we'll hang this up. Okay. Now we are going to move on to the Rocephin. Like I said, we're going to put this in the higher position for our Ivy piggyback. Okay, once again, we're going to have the primer at the top, and we're going to have our cap at the bottom. They have caps for sterility, but we're going to make sure to take that off to make sure we have no bubbles. So, we'll get my piece of tape. We are going to spike the bag. Our roller clamp is off. And so if this isn't long enough, we can actually take it and hold it above the sink. But we really don't want to waste any because this is an antibiotic and it's vital that we keep as much as we can. But we would turn the roller on. We would prime, let all the stuff come out, and make sure, you know, we have it no bubbled. Then we would turn it off. So then we're going to get an alcohol prep pad and we're going to clean the end of where the cap was. And then we're going to insert it to this one above the Y. But we're also going to clean the area where we're about to stick it in. So we have it. We're going to tape that guy on. And then we're going to make sure that all the caps are on to prevent from breaking sterility. And while we're here, we can just go ahead and check this one more time to make sure we've got it for the right person. Mr. Doe for both. We've got the right meds. We've got our Rocephin. 1 gram IV piggyback daily at 0900, and the same for the normal saline is going to be at 0900 for 30 ml an hour. So we've got the right person, the right med, the right dose. It's going in through IV. I'm sorry. The room number is going to be, his room number is 316. Date of birth 12/10/91 with the MOR number of 1234 for both. So all this is going to happen today, which is 6/10/20. So now we're actually about to go into the patient's room to give the meds. So we're going to knock. I'm going to say, hey, my name's Ashley Crosby and I'm your student nurse today. Can you give me your name and date of birth? So it's Mr. Doe, 12/10/91. I've got his MOR, I've compared it. So, and he's in room number 316 with the MOR number of 123. So I'm going to set all my stuff down. Hang up our nice IV pole here. I'm going to hand hygiene. Alright. So, as we're pulling out our meds, we're going to do the 5 rights. So we have our 2 flush, And then I first pulled out the Lasix 5 mil. So here we are, Lasix 20 milligram IVP 2 times daily. The first dose is going to be at 0900, which is 0900 now. This is going to be 1 increment every 12 seconds, so it's 0.5 mil. So on today's date, which is the 10th. So we've got that, and it's ready to go. So we've got our 2 bags hanging. We have the Rocephin. That is 1 gram IV piggyback, and it's going to be daily at 0900, which it is, on the 10th. So it's going to have 100 mil an hour, and then if we ran it through gravity, it's going to be 25 drips a minute. So that's roughly going to equate to about 6 drops every 15 seconds. Our normal saline is going to be 30 mil an hour, which we're going to DC after the piggyback is complete. So we have the normal saline. It's going to be given at 0900. It has an expiration date. The other 2 meds that I previously listed, the Lasix and the Rocephin, they are also in date as well. This is all for Mr. John Doe. Date of birth 12/10/91. Room number is 316, and the MAR number is 123. Before I get started, I'm going to ask the patient if he has any allergies, and he has said no. Thank the Lord. So I will get my gloves out of the box. Okay. So the first thing that we're going to do is we're going to actually give the Lasix. But before we do that, we need to clean the site. So we will clean this for 15 seconds. When it's complete, we're going to let it air dry. We won't fan it. We won't touch it. So when that is done, we're going to take our flush. We're going to connect it. And then we're going to unclamp it. And then we're going to run it. So we've flushed it. And then we're going to clamp it back. Okay, and take our flush off. Then we're going to clean it again, of course, for 15 seconds, and then let it air dry. So now we have our Lasix. We have it at 0.5. We will take the end off, put it in the sharps container, and then we will connect it to the port. So this is where we will be timing it for the 1 increment every 12 seconds. And this is going to go for a full minute. So it's hard to see because our label's in the way. There we go. So we would start, go 1 increment. Sorry, I'm going to fix what I just did while we're sitting here. We're going to unclamp that before we get started. So we would do the 1 increment, wait 12 seconds, do another increment, wait 12 seconds until this is completely finished, and then we would reclamp. We would unscrew, throw in the sharps container. And of course, we're going to clean it again. 15 seconds. Okay, we're going to take our second flush. We're going to put it on. We're going to unclamp. We're going to flush it. Then we're going to clamp it again. Take this off. Clean it again. So now we're moving on to the actual IV bags. So we are going to, sorry y'all, I wouldn't do it with real tubes, I promise, maybe, but my bag's here. So before we get started, we've already cleaned this. It's still clamped. We would now clean this. 15 seconds. Let it air dry. And then we are going to, we would screw it on, but for COVID's sake, we are going to tape it on. We would make sure it's nice and secure. We're going to leave it clamped until we have everything figured out. So first we're going to go to R07. We will be using the clamp. We would be adjusting it. So while we're timing it for our first 15 seconds, this is when we're going to use this to figure out if we have the right drips per minute or not. So like I previously stated, we're going to have 6 drips, roughly around 15 seconds. And then for the full minute, it would be 25. So you would stand and you would time it. Then once you have the correct drips, you're going to stand here and time it for a full minute. So our R07 is good. So now we're going to go our normal saline. We know that it's going to be the 30 mil over an hour. So we're going to cut this bad boy on. We're going to watch it go all the way through, making sure we don't have any bubbles. We don't want any problems, any kinks. So if everything's good and set up like we want it, then we're going to unclamp it and we're going to let it go. So as this begins, we're going to tell him if he has any side effects, symptoms, redness, burning, itching, dripping, rash, if he starts to feel sick, anything to let us know. Then we would start cleaning up our area. All the sharps are in the sharps container. We put this in the waste bin. We wouldn't head bang the patient, sorry. Then we would pull our gloves off. And then we would hand hygiene. Before we leave, we're gonna have them in the safest and lowest position. And the call light is gonna be within reach. So, and then at that time, I would document that I give the medications through IV at 0900 in the morning. So it's been some time later and I'm at the nurse's station and I just received the order that Mr. Doe is gonna have his IV discontinued. I've reviewed all of his lab work. He doesn't have anything abnormal, so I'm not gonna report anything abnormal to the doc. So I get all my supplies and I take off to the room. So I knock, I come in, I say, hey, my name's Ashley Crosby. I'm the student nurse from Bevel State and I'm in here to remove your IV. Can you give me your name and date of birth? Mr. Doe, 12/10/91. We're also going to compare that room number, which is 316, and his MAR number is 1234. So, I'm going to hand hygiene. Get my gloves out of the box. Here we go. So before we get started, I'm just going to go ahead and put the towel underneath the moisture barrier, just in case, but we're gonna hope nothing disastrous happens. So, Mr. Doe will lift up there, and that's ready to go. So we're gonna first look at our bags. We're gonna notice that everything's drained properly. So we're gonna turn off the roller clamps, make sure everything's stopped. Then we're gonna go over to Mr. Doe and we're gonna clamp that. So we are going to disconnect. And if we have any fluid left, we will turn it back on and run it in the sink. So once we are finished with that, we will throw the bags away in our trash can. So now we're going to clean the sites with our IV prep pads. So we're gonna make sure everything's cleaned up real good. Alcohol also helps with tape to come off. So everything's cleaned up. Throw that guy away. We're gonna start to pull our tape off. I've noticed that there hasn't been any sign of the infiltration. So I've also noted that there's not any signs of phlebitis. And one of the main things that you really want to touch on is that you're never going to use scissors for this, because that puts you at risk of cutting the catheter, and nobody needs a lawsuit today. So we've got that guy off. We're gonna work our way to the bottom. Gonna hold it so it doesn't pull it out. Okay. All right. So we always want to hold secure of the catheter when we're getting these last pieces of tape off, because, you know, we don't want it shooting out anywhere. So we've got one piece off, and we've got the other. While we've still got this, we want to get our 2x2s. So we're ready whenever we get this tape. We don't want to apply pressure when we get everything untaped. And when we pull the cath out, it'll be real nice and gentle. We'll then apply pressure and throw it in the sharps container. When we pull the catheter out, we also want to make sure that everything is intact and it is the length that it was when it originally went in. So now that 30 seconds has gone up, we notice that there isn't any bleeding, but we're still going to grab a Band-Aid just in case. So, got our Band-Aid ready, and we will put that guy on there. How lovely. Throw that away. We want to teach our patient that if bleeding starts again, that he needs to call us, or if he knows anything just not right happening, we're starting to leak, we've got more bleeding, rash, all that stuff. We are going to start cleaning up everything. These are here. This. We would return his bed in the safest and lowest position, and we would want to make sure that his call white is within reach. And so we would have everything cleaned up. We're going to take our gloves off. And we would hand hygiene. And then we would step out, then we would go document. So I have, it's 6/10/20 at 1800. Order received to DC the IV cath. The angio cath 22 gauge removed from the right hand. The catheter tip was intact and at the length it was when it was inserted. There was no redness, swelling, tenderness, nor drainage at the site. Pressure was applied to the site for 30 seconds. Bleeding stopped and a sterile 2x2 gauze dressing applied and secured with a Band-Aid. Patient tolerated the procedure without any pain and anxiety. We instructed the patient to notify the staff if bleeding continued or he experienced any discomfort. Signed, A. Crosby, student nurse.